Hello friends, I'm Dr. Pankaj Walecha and I'm a hip and knee surgeon in New Delhi, India. Me being an orthopedic surgeon, I see a lot of patients with hip and knee problems, hip and knee arthritis when they are in advanced stages where they require surgical intervention. And I've done lots of videos talking about the best treatment options, the best surgical options, and how you choose the best treatment plan for yourself. But I'm aware there are so many people who want to know how to prevent these diseases from happening. Keeping that in mind, we did a podcast with Rishane, and Rishane has been doing a lot of educational as well as entertaining videos on Instagram, and he has been doing it for quite a while now. We found the videos very informative and very scientific. So, this podcast is very insightful because we are talking to each other about hip and knee problems. I am seeing the problems through his lens and how he helps people in preventing those problems. At the same time, he asked me so many queries about the treatment of hip and knee problems. So let's dive in, friends, and I'm sure you'll enjoy this podcast. Rishane, welcome to the show. And I would like to know from you, how do you define what you do? I mean, just let us know about you a little bit.
Yeah, so I'm 24 years old.
I'm a personal trainer and a strength and conditioning coach. I work primarily with athletes, but I also work with general population. Where I specialize is getting people back to sport after they're done with PT or after they're done dealing with injuries and they're ready to kind of get back to running, jumping, lifting heavier weights, and they want to figure out a program and a structure to do that in a safe way. Or they've just been dealing with chronic pain, chronic injuries. My biggest goal is to just have people moving better, feeling better, and just optimizing their health to the best of their ability. Do everything they're able to do to make sure that they're staying as healthy, fresh, strong, happy as possible.
Fantastic. I mean, I am so excited to have this conversation with you and also learn a lot of things from your perspective, how you view things and how you kind of handle things. It would be a very interesting conversation for me and for my viewers. So thank you for agreeing to come on the show and share your experience with us.
Of course, I'm excited. I'm looking forward to it.
Fantastic. What got you into this, Rishane?
Yeah, so I actually struggled with my own low back pain. It was severe when I was younger. So even in school, things like just picking up my backpack were uh, really painful, really stressful for me. So I had been learning more about how to deal with that. And that's when you kind of start learning, hey, there could be things at the hamstrings, there could be things at the hips, there could be issues with the core, there could be issues with the back directly, all these different components that come into it. And when you're like a skinny 14-year-old something kid, everything is weak there. So I kind of learned through myself that, if you start to strengthen the hips, strengthen the back, strengthen the hamstrings, and develop these movement patterns through a good full range of motion, that can help alleviate a lot of those pain symptoms. And now I can say that for me today, I really don't deal with the back pain anymore. But that's what kind of got me into that. What got me more into the coaching side and the teaching side is I'm sure you're aware of this, in the Desi community, there's so many people with low back issues, and I think low back is the plague in the Indian
Actually,
community.
low back pain is something we see very often. Although me being I specialize. I'm an orthopedic surgeon in Delhi, and I specialize in hip and knee problems. And so I'm dedicated to this particular region, and that's why I've seen a lot of your reels about talking about hip mobility and about exercises, how to keep it flexible, what is the right way of doing it. I think it's important because a lot of people confuse their hip pain with their back pain and the back pain with the hip pain. They think if it is sciatica, then they confuse it. Groin pain with sciatica and sciatica with groin pain. They're all mixed up. So I think the conversation which we're gonna have today, probably I would want you to educate people a little bit about calisthenics, which is your forte.
I like some calisthenics. I've always been more of a like barbell rehab type of man. I like getting people with dumbbells, kettlebells, barbells, getting them moving well. I think calisthenics are great, and I think it's probably the first frontier, because a lot of people who maybe they don't have time to go to the gym, or they can't afford to go to the gym, whatever it might be, being able to do stuff with body weight is great. But I do think the best kind of long-term, I don't like throwing out preventative, so I'll throw it in quotes, like preventative thing you can do is get as strong as you can in some of these movements, like the deadlift, the squat, side lunge, lateral movements, transverse plane movements with the lower body. I think those are really important. But yeah, even with calisthenics, I think there's so many cool hip exercises that are starting to become more prevalent, like this pigeon raise. People are starting to do is a super easy way to train the hip through a good full range of motion. Side lunges, Cossack squats, all these sorts of things. They are really good lower body calisthenics hip movements.
You just told me that you are into mobility and strength training. You are a coach and you train a lot of people who are struggling with low back pains and hip pains and knee pains. Tell me briefly, what kind of people are you seeing the most? Which age group? Do you see 20 to 40-year-olds, or do you see elderly population, or do you see any other age group? Just take us through it.
Yeah, I see a pretty good mix. Unfortunately, though, I am starting to see that it's getting younger and younger. The populations are starting to have more and more hip and knee issues and things like that, which is really sad to see, because I almost feel like we're at a time where there's more information than not. You can go on the internet and there's so much more access than we had.
Yeah.
But the hip and knee issues are becoming more and more prevalent. But who I'm primarily dealing with is, generally people in their 30s, 40s, people that want to either get back to their life, their day-to-day, and move through that pain-free. So whether it's getting up out of a chair, being able to pick things up and do that pain-free. And then also people trying to get back to sport, like cricket, pickleball. There's all these sports that aren't necessarily extremely taxing on the body, that people want to do, that people want to feel good and move through these. But I know plenty of people that don't necessarily feel very comfortable playing sports at a picnic or at a get-together because they're scared that they'll hurt their knees and their backs. And that population tends to be in their 30s or 40s.
So what are the common mistakes you see people are like making while training? Because a lot of people go to the gym, local gyms, at least in India, and they are being told different mix of exercises. Sometimes a lot of people come to us with gym injuries. Common injuries or common problems or common mistakes do you see when you see these youngsters?
A lot of the times I'm seeing very locked up hip internal rotation. So if someone right now were to try to just rotate their heel to the side as much as they can while keeping their knee in place, that would be an example of hip internal rotation, or they could look it up if that's not making sense. And a very common way to develop that is moving through all three planes of motion. So we always think front to back in the gym. That's the most common way. So if you think about the squats, the deadlifts, even your lunges and things like that, it's all front to back or sagittal plane. That's where everyone is moving, but the human body was designed to move in a few different planes. So when we have like the transverse plane, which is just being able to rotate, that's great when you're going through sports, when you're training those types of rotational movements. That's very good for you, especially because the hip is a ball and socket. It's designed to rotate, and then people aren't necessarily doing that. And then also moving in the frontal plane. So that's just moving side to side. I see a lot of the times people will never do that. And then the first time they end up in a PT clinic, you'll have really big, strong, I'm sure you've seen this too. You'll see like a really strong, jacked guy, big legs, everything. But then you have them, just throw a band around their ankles and start doing a lateral walk to turn on like the glute medius minimus. And they're like, oh my God, this is burning. Everything's on fire, because they're not training that. So the biggest message I can say is, we need to start emphasizing these other planes of motion, not just the front and the back, not just what makes you look super jacked, sexy, hot, whatever you want, whatever you're going for in the gym. But we need to also focus on things that have you moving well, moving like an athlete, so that your joints are moving the way they were designed to.
Correct. So, I mean, if you have good mobility in terms of rotation as well, and good flexibility around your hip and knee joint, that prevents the possibility of sustaining an injury in the gym or otherwise in like daily life, isn't it?
To a degree, yeah. And once again, I'm always hesitant, and you know this too, like about saying prevent, because you can have the strongest people ever and they get injured, like stuff happens, it does. But we're going to drastically lower our chances of that, because if you're able to get into those positions, and let's say you can get into that position while holding 50, 60, 100 pounds, now you're much more likely to be able to get into that position and not deal with an injury. And with sport, we see it all the time. You misstep sideways, or you have a bad twist. That's how all the ACL issues are generally happening.
Correct. I agree. Did you see Kane Williamson injuring his knee during IPL match? If you follow cricket.
I did. That was a twisting injury, right?
Yes, correct. He
Yeah, yeah,
just
yeah.
pivoted. His knee pivoted when he
Hmm.
landed outside the boundary. It commonly happens. I agree, and so that's why it's important to follow a structured protocol, a structured exercise program with somebody who's an expert, rather than trying out with gyms. We also do in Delhi. We call a lot of gym trainers to us, and we kind of try to educate them when you should not treat it at gym and think it is just a muscle sprain or a ligament sprain,
Yep.
and rather kind of send that person to a specialist to evaluate the individual.
Could I ask
Have
you a
you-
question, Dr. Pankaj?
oh yeah.
Do you see any, like, let's just use ACL, I think, because I feel like that's the most common one, right?
Mhm.
That and most well known. Do you see a lot of these ACL injuries with the squats, with deadlifts, with gym related? Because from what I've seen, it's not very much gym related. It's very often sport related when it comes to knee ligaments and tears like that. Am
I
I
fully
correct by
agree with
saying that?
you. Yeah, I fully agree with you. It's not that commonly seen in the gym because more or less you are like pumping weights, or you are not really pivoting your knee, and you're not really jamming your foot on the ground and suddenly twisting your upper body over the knee. That's the common mechanism of injury for an ACL tear. So we see footballers, hockey players, and cricketers, and also road traffic accidents. People
Yep.
when the bike falls onto their leg. I have seen ACL injuries in the gym also, but that's not very common. Typically, when a person is trying to, a typical, you must have gone through that particular video which was there on TikTok. A person is trying to go back with his
Yep.
knee, with his legs locked,
Mm-hmm.
and suddenly the ACL popped.
Yeah,
So,
that's
yeah.
the Spanish squat. That's the and the Spanish squat is technically safe if it's loaded correctly, but it's literally priming that same anterior tibial translation. It gets a little funky there. But yeah, that is the only time I've ever really seen the ACL tears
Mm,
in the gym is with that Spanish
mm,
squat variation. But I've never heard of someone on like a traditional barbell squat,
mm.
just squatting and their ACL just boom out of nowhere goes.
Yeah, I fully agree with you. Yeah, that's not the common mechanism. Fully agree.
Yeah.
In India, we see a lot of people who are yoga enthusiasts, and yoga is like, I'm sure you know yoga. Like people do
Oh
all
yeah.
different kinds of yoga, extreme mobility, extreme stretching. I happen to see a lot of young women. By young, I mean 30 to 50 age group,
Mhm.
and they would be doing yoga for fitness, and then suddenly they come with groin pain while doing Surya Namaskara or while doing some that kind of an exercise. How often do you see such people, and how do you kind of help them?
Yeah, I see it fairly common. It's a common occurrence here
Mm.
because the yoga scene where I'm at is actually very popular. I'm not going to get into the whole reasonings why. That's a fun little Michigan secret, but very common here. I see a lot of that in that same age group because mobility is very important, and a lot of people don't have enough. I'm not going to pretend that like, oh, everyone has really good mobility and that's
I
our
agree.
problem. Most people don't have enough, but there's also plenty of data that shows that if we don't have good load management, that's where we can run into issues too. And when we look at things like osteoporosis, we're
Mhm.
talking about like a lack of muscle mass, a lack of good solid strength there. I mean, there's plenty of different factors too. Oftentimes the issue with just doing calisthenics, in my opinion, and I would say yoga is body weight, just doing calisthenics. And I love yoga. I've done yoga forever. But you also have to introduce the load component to strengthen the hip. And there were a few studies done by I think Ebony Rio where they had people doing just low load and a long duration of exercise. So let's say they did an hour and it was very lightweight versus heavier weight. And it was a shorter duration, and then tendon stiffness was getting drastically improved when you were introducing heavier weight and heavier loading to keep everything strong and resilient. So,
That's interesting. Yeah.
oh yeah, and that's what really changed my mindset a few years back because at first I was like, you just have to stretch everything out, but that's not the magic trick. At the end of the day, if there's a weakness issue, we have to have a level of load. I've actually trained a woman in her 60s who did yoga forever. She was big on yoga, but she had some low back issues. She had some hip issues. Kind of just she's literally the exact population that you were just telling me about. And then once we started getting her very strong on the deadlifts, now she's deadlifting more than her body weight at 60 years old. Side to side movements that addressed a lot of those hip weaknesses, and now her low back pain is non-existent.
That's very interesting. Yeah. Didn't
Yeah.
know about
So
that actually.
yeah, my biggest takeaway would
So,
be if you're doing yoga regularly, it's fantastic, it's awesome, but you should also just have 1 or 2 days really of just good solid strength training under load with dumbbells, machines, kettlebells, barbells, whatever. And I mean, that's such a well-rounded approach to your fitness, I think.
That's interesting because over here in India, people feel if you're doing yoga, and everybody is a yoga instructor in India. Let me tell you this. No, so self-proclaimed yoga trainers, and people end up doing yoga every day, and they don't mix it up with the weights. And I think it's a very important message. I mean, I'm also surprised, being an orthopedic surgeon with an experience of 20 years. I am also kind of surprised that rather than doing stretching exercises for a prolonged duration, as compared to doing some weights along with it for a shorter duration, is more beneficial to take care of kind of stiffness, isn't it?
Yeah, well, we want a nice stiff tendon. That's the goal. And oftentimes, if your tendon never really has to stiffen up, and the tendon becomes very stiff when you force it to have a lot of load, or when you make it contract very quickly. So let's say you jump or you sprint or something, that's also going to create tendon stiffness. That's how we can create that rigidity. But if you never expose your body to that, it's like if you don't use it, you'll lose it, right? Then your tendons never get stiff ever. Then you're not able to contract the muscle very well, and then you become weak. When you become weak, you have poor load management, and then when you have to pick up something heavy, you're going to be much more likely than a strong person to be able to do that pain-free.
That's nice. I think that's a very important and very good piece of information for people who are into fitness and who are into fitness in their middle age also. I, as a surgeon, see a lot of young women ranging 30 to 50 who would be doing yoga and would be doing it really well for years together. And then suddenly they will come to me with groin pain. And groin pain in an orthopedic surgeon practice raises very different kind of questions in your mind as compared to you as a trainer. Probably you would think as a hip flexor pain, or you would think in terms of muscle stiffness, but we commonly think in terms of labral tears and the possibility of maybe AVN or avascular necrosis, things like that, because we are more trained to treat diseases, and we kind of start looking for diseases when we see people. So I have seen a lot of younger women coming with labral tears, acetabular labral tears. And then of course, depending upon the kind of tear that woman has on MRI, we would treat either arthroscopically or we would treat conservatively. That's the usual thing we see. How often do you get an MRI done for people who have anterior hip pain which is not settling down in the groin area?
Yeah. So
do you send them to a specialist? How do you kind of take care of that?
Yeah. So, and this is something for all trainers, and I think it's very important, because I think you were talking about it earlier. A lot of trainers will try to do stuff that's out of their scope, that's not necessary. If I ever think that someone needs to get seen, I tell them, like, go get your MRI done, talk to your orthopedic surgeon, ortho, PT, whatever you need to do. Like, I would never look at someone's MRI. I would never take someone's MRI results and do anything with that. But oftentimes, people kind of, maybe, I think they kind of know to a degree if something is going to be, if it's super, like, the check engine light is flashing, it's like not a big deal, or if it's like a very big deal. And then, I mean, I'm sure you've seen it plenty of times where people have a hip tear and they don't even know. So that does exist too. But if someone needed an MRI at that point, that's where I kind of pass them along to an orthopedic surgeon or the PT team. They have to get whatever has to get done, whether it's surgery, whether it's like a lower form of rehab or something. And then once they get back into the gym, that's where I get to come back into play. And that's still no easy task. It's not like when you get someone who's coming off of a surgery, even once they're cleared for PT, that they're magically good to go. Because a lot of the ACL people, once they're cleared from PT, that doesn't mean they're ready to go squat 500 pounds and jump off of things. Like, they could be ready to get back into the gym, but they still have to build back up. Like, if you're coming off of hip surgery, which I think is one of the toughest ones to recover from, just getting back into squatting and deadlifting after you're cleared from PT, you might have to teach a lot of these habits and these motions. Like, especially with the opposite is true after a knee surgery. How often do we see when someone's landing, their landing mechanics, they land and everything goes to the hip, right? They just don't want to let their knee bend because they came off of knee surgery. The exact opposite can happen with hip surgery. They might not be able to sit back, or when they're deadlifting, they might just want to use their quads instead of using the posterior chain. So instead of using their glutes, instead of using their hamstrings. And these are big issues, because if people are just overusing the quads and not using the hamstrings and glutes after a hip surgery, now at almost more risk to start having knee issues or having other hip issues down the line. And I think I saw something where with ACL tears, guys are so much more likely to tear the other ACL, because what tends to happen is they get back into sport too quickly, or they get back into activity too quickly, and then they start favoring one side, whether they know it or not. And then, you can have these other issues. So you are still fighting the good fight, trainers, by getting these guys back in and then making sure they're getting back to good quality levels. But we also have to understand in training that we are not medical professionals. We have to let the doctors, let the physical therapists handle what they need to handle. And then once they're ready to get back in the gym, that's where you should be very knowledgeable about what happened, make sure you have the right protocols, and then get them back.
Yeah, fantastic. I think it's a very, very good message to give. I mean, there is a role for everybody, for a fitness trainer, for a physical therapist, and for an orthopedic surgeon. I mean, we should work as a team rather than trying to treat everything by our own speciality, so to speak. Because a lot of gym trainers do that, and a lot of physical therapists also over here in India would prescribe an MRI and then try to kind of treat the patients. Absolutely appreciate what you do, because when you know that something is not really the thing which you have seen commonly in your practice or in your experience, and something is beyond that, then it's the time to involve the specialist and diagnose that problem so that the other person doesn't suffer, isn't it?
Absolutely.
Yeah.
Absolutely.
I have noticed that people who are doing ACL rehab, sometimes they end up doing only knee exercises. And as you rightly mentioned, and I would agree, that your gluteal muscles and your hamstrings are completely neglected. And then you think, okay, my quads is looking good and I should go to the gym. And the gym trainer gives you the same regime or the same set of exercises which is given to everybody. And then you end up injuring either the opposite ACL or having some problem with the hip. So, I mean, we were also thinking of discussing with you. A lot of people have doubts in their mind that I have an ACL tear and I should go for surgery straight away, and then I should strengthen my muscles. Vis-a-vis, what is your take on doing the prehab first, building up your muscles and strengthening up your muscles and getting some flexibility, and then going in for surgery? I mean, do you see such scenarios?
Oh yeah, absolutely. So first of all, I think if someone right off the bat, if someone has stronger quads, I feel like they're going to be much less likely to deal with any of this inhibition or something like the quad completely turning off, compared to someone who has maybe never worked out before.
That's
What I
correct.
would say is if someone knows that they tore their ACL or something, the first thing I think would be to go to PT, because even just something like getting stim on the muscles where maybe you can't contract it well in a squat or a leg extension, but maybe you can have some level of contraction, that's going to be really important. Because what people, I'm not sure if people know this if they haven't gone through it or anything, but you can have the arthrogenic inhibition. So basically your quad just doesn't work. You can try to fire your quad, it just will not work. It will not, nothing will happen. And that can be a really big issue, because if your quad isn't working, that basically means your knee isn't extending. And then when you're trying to save yourself while walking, or not save yourself, while you're trying to land while walking, when you're trying to go upstairs, you don't have the quads working, and that can be a really big issue. So absolutely, having good strong quads beforehand is going to be really important. And then especially if you know there's a tear, having going to PT, getting stim, doing all those types of things are going to be really, really important. And then even in a more general sense, a big issue after an ACL tear can also be regaining full knee flexion. So getting your knee to bend all the way. So if you're doing
Absolutely.
exercises that are generally training your knee in deep flexion, and I'm not saying you have to go with very heavy barbell squats, ass to grass is the saying, right? You don't need to be doing all that, but just having exercise like the ATG split squat, I think is fantastic for just teaching deep knee bend. And then for the barbell squat, which I don't think you really need to be going all the way down, you can strengthen the quads, load the quadriceps tendon in a way that's safe on everything else. And then that combination of having good mobility while also having really strong quad musculature, and then the surrounding tendons of the knee are strong as well. That's such a better recipe for a clean ACL surgery and recovery, as opposed to someone who has just never worked out and those muscles are weak and they lack the mobility and things like that. And the reality is ACL tears happen to very strong people. ACL tears never happen for some really weak people. But our goal is if stuff happens, if you were to be in this case where something tears, how are you going to recover? Are you going to be confident in your recovery? Do you have a plan there? I think those are things that we can control. Whether or not something will tear is not something we can control.
Correct. So, I mean, that's what we also tell our patient. I'm glad both of us agree. We tell the patients, okay, don't go in for an ACL reconstruction right away because we need to cool the knee down. We need to get the swelling down. We need to get the quads firing. And we need to get good flexibility and range of motion before we go in for the surgery. And that's the best time to go in. And we reinforce a lot of the importance of pre-habilitation in our patients' minds. And that's the time. If we do the surgery at that time, then they really recover fast and they get back to their normal routine much quicker.
Yeah. And what do you think about people that, I mean, there's also some people that say, like, if you have an ACL tear, you might not even want surgery. What would you ever say to those people too? I'm
So,
sure you've had a few of those, right?
Yeah.
Had to been a couple.
We see such patients. So we have observed people who are doing a lot of pivoting sports are the ones who would come early for the surgery.
Yep.
Because you get rotatory instability, your knee is not stable in rotation, you feel it is subluxating. As compared to people who are doing a lot of routine work, going to the office, sitting in a car, driving, going to the office, taking lift. These are the people who can actually pull on with a torn ACL for a very long time.
Yep.
Because these are the people who can live with ACL deficient knees, even with weak. They know their quads is weak. They know the thigh circumference is different, but they can pull on. They don't feel the instability because they are not doing that kind of activity which requires rotatory stability. So yeah, we have a good percentage of patients who would not come for a surgery because they think they're all right. But we always tell those patients that if accidentally while dancing or while doing some activity, if you just your knee pivots, then you may have a meniscal tear, which is a bigger problem to kind of treat. Because once the meniscus is gone, once the cartilage is torn, then you can have knee arthritis earlier than if it wasn't there at the first place. So that's the downside of not having a surgery done. But yeah, I would agree with you. A lot of people think that they don't need it. They're not unstable.
Yeah. And then even when we're talking about that, if someone's dancing, pivoting, and they aren't able to stabilize, there's not a ton of musculature at the knee that is going to prevent that side-to-side movement. There's not a ton. But the hip, that's where that really comes into play, right? Making sure that you're not overshooting, making sure that your knee isn't buckling in, buckling out. Internal rotation is literally your knee is going to be inside the ankle. That's how you can kind of think about it. There's plenty of different ways that you can create hip internal rotation, and if the knee is inside the ankle, you are creating that internal rotation. So if you're not strong in that position, if you're not strong in external rotation, if you don't have great hip stability and even ankle stability, which I think people don't talk about enough, or foot strength stability, if you don't have much stability and strength in the surrounding tissue, you're going to be a lot more likely to have these accidental pivots, accidental cuts, and these are just avoidable things. These are, if you have strong feet, strong ankles, strong hips, you're just going to be much less likely to deal with these issues. So that's why I really think people should be focusing on that, not just from a vanity sense, but also from a preventative quote unquote sense as well.
That's a wonderful message, because you need to have good strength and mobility around your hip, knee, and ankle, because the whole lower limb works in tandem, and it's important to work on all the three parts, and specifically work with a person who is trained enough, who knows his job, and who can really guide you well. Because during these processes, people tend to have some niggles here and there, and either they will stop or they will continue to push, and they don't know what injury they are dealing with, and then they land up in the doctor's clinic.
Oh yeah, absolutely. Yeah. And every little twinge here and there isn't necessarily a cause for concern, but if you're constantly dealing with twinges, pains, there's these chronic issues, that's when you really need to kind of take a step back and say, like, look, I'm dealing with all these aches and pains right now in my 20s or 30s. What's this going to look like in my 40s, 50s, 60s, 70s, 80s, 90s? You kind of have to have that conversation with yourself and look at it down the line. And that's what I tell these kids too. It's like, look, if you're 16, 18, and your knees bug you every single day, you're not getting any younger, brother. You're just going to be getting older. A lot of these things are going to get worse. So you do need to change up how you're training. You do need to focus on these other muscles, because everything does work in tandem.
Wow. That's an interesting message to give to the youngsters, actually. I mean, that's a very good way of thinking about your knee health or hip health. Like, if you are troubled with it in your 16, 18, 20 years of age, then it's only going to get worse. And believe me, you can get a new model for your car, but you don't get a new model for your body. You'll have to sustain with it, isn't it?
Exactly. And it's not even like it's going to get worse. It can get better if you do the right things.
Oh yeah.
That's the thing. If and I know that's not what you meant, but they hear that it's like, oh, my knees hurt. Oh, well, I'm just going to do the same machines only. I'm just going to do hack squats and leg
Mm.
presses. I'm going to ignore free weights. That's a very silly way of thinking, because if you're dealing with these aches and pains, and there's plenty of evidence out there that suggests that your body should move in different directions, and we were designed to run, to jump, to walk, to move side to side, and you're neglecting all of those things, and you're
So
wondering
true.
why you're in pain.
So true.
You need to change it up. You have to.
Yes. So guys, I think the message is that it's not only about exercising or pumping iron, it's about moving your body in all directions, because that's how human body is designed, and that's how you should be thinking about your fitness, and not only in terms of going to the gym or just being a runner or just being a particular type of exercise or maybe doing yoga every day. It's better to move your body in all the directions and get good flexibility and mobility. When you start seeing a person who is coming to you for training, do you start with the upper body exercises first or the lower body exercises first, or how do you take it forward? Just take us through it.
Yeah, we definitely have to get both. I think the lower body, it seems like it gets talked about more. I think it just generally does more views on social media, if I'm being honest. I think knee, hip, foot, everything like that will generally do more views than shoulder
Yes.
and elbow. I think the shoulder and elbow are more fun, if I'm being honest. I think they're fun.
Ah,
They're more interesting joints to me. There's way more mobility in your
ah.
shoulder and
Why do you
forearm
say
than
that?
there. Because
Why do you say
there's way more range of motion in the shoulder, and then
that?
in the forearm I can twist my hand over and over like this. My foot, it just rotates side to side a little bit.
Mm,
The ankle barely moves, hip barely. I mean, the hip doesn't move as much as like the shoulder and wrist do.
correct, correct.
But I think there's just more demand on the lower body. People walk on
Mm,
their legs all the time. I don't know
mm,
whether they're using their upper body a whole lot.
mm.
Um, and that's why I think it's more common. I think it does more views, but in general, I think they're both very, very important, and especially because a lot of the times when we're thinking about climbing our way up, right? I think knee pain is very common, hip pain is very common, low back pain is very common, that trunk area is very common. But if we think about it, right, if you're constantly just kyphotic everywhere, like you're just hunched in everywhere up top, what do you think that does to your lower back? What do you think that does to your lower body? What do you think that does to your hip mechanics? I mean, even on a deadlift, if you are unable to engage your lat muscles correctly, that barbell is going to be further away from you. So because you didn't train your upper body correctly, and now this barbell is way farther away from you than it needs to be on your deadlift, you're putting all this extra strain on your low back. You're putting all this extra strain on your hips, all because you didn't know how to use your upper body correctly. So I
Mm.
wish that people would focus a little bit more on the upper body, honestly. But I think the first point that people deal with pain is generally not going to be shoulder, neck. I think the shoulder issues, neck issues, elbow issues, those kind of happen for people who've been working out for a long time, and then those things pop up. And then a lot of the knee, hip, those pop up for people that may have never worked out. That's why I think those do more views generally. Uh,
Mm.
but it's all connected. If you're Everyone knows on a bench press, if your legs aren't working correctly, that can affect your shoulder position. On a deadlift, the exact opposite can happen. If your lats aren't working correctly, if your upper body isn't working correctly, your lower body can get thrown off. So you have to be well rounded. It's one of the most important things. So if I get
Mm.
someone in, yeah, we address both. And my favorite type of training split is actually a full body anterior, full body posterior 4 times a week. So what that means is we'll train the entire front of the body, chest, shoulders, triceps, quads, and then calves. Calves and triceps are technically on the back of your body, but they work in a pushing movement, which is the front of the
Mhm.
body. And then posterior, which will be like the back, the biceps, the glutes, and the hamstrings. And that's very pronounced because anyone who deadlifts, anyone that picks up a heavy object, they know that your back, your glutes, your hamstrings, they're all working together on these movements. And then the athletic populations know that when you're pushing, let's say you're doing a landmine push press or like a barbell split jerk, that is going to be all quads, all shoulders, all your push muscles working together too. So That's one of my favorite ways to program for general population. Just whoever, like if I get some person who's just like, I kind of have been working out for a little, I want to take things to the next level, I throw them on that split, because that's how they can really start developing these fundamental skills of having your body move together as a unit.
That's very interesting way of looking at it. So far, I mean, I have met a lot of people who would exercise in rotation throughout the week. They're doing their shoulders, and they're doing their back, they're doing their glutes, and they're doing their lower limbs. Rather, you look at it very differently. At you anterior first, and then posterior, and then repeat. Is it so?
Yeah, and it depends on the person. Like if you're a pure bodybuilder or something, and I mean, not all you care about, but all you really care about is looking very big and or something, then yeah, something like that, like a pro split works very well, where maybe it's shoulders and arms one day, then back and chest one day or whatever. But I think the general person who's trying to get stronger, trying to just look good, while also feeling good, if they lack these fundamental movement patterns, like let's just say like a lunge, a hinge, if they're lacking these, they're going to need that repetition. And that's where these types of splits come into play really well. So I would say that the pro split is actually like fairly advanced. A lot of these bodybuilders, they'll surprise you with their mobility and their flexibility. And if they're training some of these accessory movements well, they're going to be very strong there. So then in their case, they should be using that split, and that's going to work very well for them. But for the general person who's maybe not working out that much, they need to be set up on a program or on a split that allows them to train all their muscles together. That's super important, because they're just not getting that on a day-to-day.
So what's your message to all these like so-called bodybuilders, so-called people who want to like beef up? I know so many of them. A few of them are doctors as well. And so besides pumping muscle, pumping iron, what else they should do if you have to give them a message in 2 lines?
Do your accessory exercises to keep everything safe, keep everything healthy. And then nutrition is going to be the most important thing, making sure that you're getting in your calories. Most people don't want to or are physically unable to eat the calories that are needed to put on a bunch of muscle. And it's a lot higher than people would expect.
And I was also happily surprised to hear that you see a lot of so-called bulky, heavy guys with good flexibility, which is like, I couldn't imagine them together. We usually think people who are like pumping iron in the gym, they're very stiff. But
oh yeah. Well, and we're finding all this new data, right, where there's stretch-induced muscle hypertrophy. So when you take the muscle to a longer length, it's more likely to grow bigger for some muscles. So when you look at a guy like Tom Platz, who the quad father, greatest legs of all time, right? He would do these very deep squats. He could do full reverse Nordics. He could do splits. He could do all these things. And it's highly likely that because he took his muscle into these deep lengths, he was able to get this stretch-induced hypertrophy. He was able to have quads that were just the size of both our heads put together, Dr. Pankaj. And he was able to do that. And he's in his 60s or 70s right now, and he's still squatting very heavy weight very well. And it served him well. Ronnie Coleman, too, is probably one of the best bodybuilders of all time. He could do full splits at 5'11" and probably over 300 pounds. So it's very impressive. I do see a lot of bodybuilders that are very stiff and can't do any of that. And I worry for them. But the idea that you either have to be super big and jacked, or you have to be super healthy, mobile, and flexible. You can't have both. That's crazy. Because when you look at the best guys, they were actually able to do both.
So guys, you don't need to be, don't imagine yourself being a gym goer, a heavy guy with a stiff body. You don't need to walk like a Hulk all the time. You can have good flexibility as well in your joints, and can feel even more fitter and smarter. Isn't it, Rishane?
Absolutely. Absolutely. The two, I call some of them lazy, and I'm not trying to attack them, but they say like, oh, the mobility and flexibility stuff doesn't matter. It's like, well, I would agree with you if the best bodybuilders weren't flexible, but there's enough evidence that the best bodybuilders did focus a lot on tissue health. Jay Cutler, Ronnie Coleman, Tom Platz, Chris Bumstead regularly gets massages, tissue work. I know a couple of the guys that he works with, and the new movement is not just about how good you look; it's how good can you look while maintaining longevity. The best bodybuilders are the ones that won and kept doing it. Sorry,
or how good you feel. How good you look, exactly. As well as how good you feel. Yes,
exactly.
Self. Yes,
exactly. The best guy, Big Ramy, he just didn't compete again because his body just wasn't feeling right. I think he was having some health issues, so he didn't
Yes.
compete. And it's almost like, well, look, if you're doing all the work to get to the stage, but at the end of the day, your health didn't let you get on there, that's tough. And I completely understand in the world of bodybuilding, there's a lot of stuff that goes on and it's very competitive. And I completely understand all of that. But the general person needs to think about that.
Rishane, do you see there's a epidemic of runners in India? Like every weekend we have a marathon, half marathon, 10K going on. Me being a long distance runner myself for 5-6 years, so I met a lot of runners during that period who were running with consistent knee pain. They're so addicted to running that they would continue to run in spite of pain. How do you take care of that lot?
So, and I'm glad that you run too, because the first thing we learned is if you tell someone not to run, you're not going to have them not run. You're going to have them find someone else to work with. That's the reality, right? I think that recovery is so important, and a good structured program is very important. So first of all, if runners are strengthening like the tibialis and the calf, that's going to do wonders. A lot of them, they never touch the weights ever, and then those muscles get very weak, and then you're just kind of slamming them. And like what we talked about, right? You're asking the tendon to stiffen up, but the muscle's not really strong. So the tendon's just having to do all the stiffening to pull really hard on a muscle that's not that strong. If the muscle's stronger, the tendon's not going to have to work as hard on a regular basis. If you look at the best runners, they actually follow very regimented training programs. So they squat to specific joint angles that are similar to your running joint angles, right? So if they're doing that, and you can look at the Olympic sprinters or even the long distance runners, they're doing partial rep squats with fairly heavy weight to joint angles that are replicating. I'm not going to throw out numbers. I'm not going to pretend to, and you shouldn't worry about the exact number either. Don't sit there with a protractor in the gym. That's crazy. Or goniometer in the gym. But they're training those joint angles, and they're working on those muscles. So if you have really strong hip flexors, if you're training squats at joint angles that are being replicated while running, if you're strengthening the tibialis, if you're strengthening the calves in the gym, those are going to be, and glute medius minimus to make sure you're having good stability, because running is rotation. People don't know that, but if you watch a sprinter from the back, you'll see a lot of rotation happening.
That's so true. Yeah,
and very underlooked. People don't realize that.
Fully agree with you. People just think like glutes. People generally neglect gluteus medius and minimus, and we as hip surgeons, they are like, we don't even want to touch them. We don't want to bother them when we are doing the surgery, because they are like most important muscle group around the hip area. Very important for the runners also. And it's very interesting fact which you brought up was kind of building up your muscle so that your tendon doesn't have to do all the work.
Yeah.
And that's when you end up with tendinitis, tendinosis, or things like that, isn't it?
Yeah. And then you can also have the opposite, which is where you're just stressing the tendon too much, where even if your muscle is super strong, that's where you're going to kind of run into the tendinitis. But the tendinosis in runners is just very common because they're not strength training. And that's why the highest level athletes, whether it's swimming, cross country, sprinting, everyone knows that the football players, like the American football players, they lift weights. Everyone knows that.
Yes.
Rugby guys lift weights. Everyone knows that. But the strength and conditioning that like hockey players, cricket players, runners, volleyball players, swimmers, they're lifting weights too. It's different than what these American football players or wrestlers or whatever brute force sport you're thinking of. It's different, but it's there. And they're following solid programming, because it's the same thing we talked about with these kids, right? If you're running now at 30, 40, and you're dealing with knee pain, what is your long-term outlook? Do you think that are you going to be walking with knee pain at 60? Is that the life you want to be living, where you're just in chronic knee pain at 60 because you didn't follow smart running protocols when you were younger? That's not a great idea. And that's why you should, I mean, there's fantastic running coaches like that have when you should be training hard, when you shouldn't be. David Goggins is a guy that a lot of people know for motivation and discipline. And if you actually watch him run, he doesn't actually run very fast because he understands that, like, look, if I'm going to run for a long duration of time today and a long duration of time tomorrow, I can't burn the candle on both ends and just be sprinting every single time I run. That's a silly way of doing it. So if you look at the smartest guys, they're following smart protocols. They really are, whether it
Correct.
comes to their strength training and their running.
So Rishane, yeah, I remember seeing one of the diplomats who flew from another country to consult for his knee pain. He came to me, and interestingly, he had a history of running a half marathon every weekend, and he was featured in the newspapers that an officer who runs half marathon every weekend, and he is doing it for years together. And then he lands up in my office with knee pain, with meniscal tear, with moderate to severe degenerative changes in his knee joint. And then all we were left with as a choice was to stop running now. He was like 45, 46. And then we had to put him to swimming and other forms of exercises. I mean, he had to completely quit running. So if I ask you 3 important tips to give to people who run for so-called fitness or to maintain a good body weight, what would that be?
First of all, get good shoes. That's so important. Do not run on old, worn out shoes. I've seen it so often. So common that people just, there's holes in their shoes. What do you expect? Follow a good protocol for your strength training and your running. Get a regimen. They're fairly inexpensive. You can get a coach that's more expensive. Do what it takes there. And then recovery with your sleep and nutrition is so important. Putting the phone away before you go to bed, after waking up, having some wind down, following good sleep hygiene habits. Sleep is so important for recovery everywhere. People kind of just brush it off as something that's not super important. If you're waking up and you're feeling more tired than you did the night before, which is so common, that could be a sign that you're dealing with really bad sleep, adrenal fatigue, like all these types of things too. So monitoring your recovery is also very important.
Correct. So I think very valid points. I would agree as a hip and knee surgeon. And Rishane, what about nutrition? Could you share some tips for people on the whole who do a lot of physical fitness in forms of running or gymming or any other form or yoga? I mean, people are usually confused. There's so much of content to consume about nutrition on the internet, isn't it? So what would be your
so much.
three important takeaways for such people? I'm sure you talk to your trainees about it, isn't it?
Yeah, I would really have one big takeaway if I'm being completely honest. I would say there's so much evidence out there of things that do work. You kind of, and I know it's such a lame, boring answer, but it is the true answer. You do need to find what works for you. And a lot of people will say, well, how do I know what works for me? If you're eating a certain food and you feel exhausted after, like you feel sluggish after, that's probably not the type of food you should be eating. And I do think a lot of it has to, there's going to be more research on this later down the line, I'm sure. But I do think a lot of it is ancestral. I think you should be eating kind of similar to what your ancestors before you were eating. We know so much about how genes dictate a lot of these things. I don't know why people would think that nutrition isn't one of them. For me, I found that, I was seeing a lot of these people that were saying like red meat and keto was the way to go. And then when I tried it, obviously, like, I'm Hindu, my ancestors were all Hindu. They weren't eating a lot of red meat. So when I was doing that, I was just feeling exhausted. I was feeling tired all the time, and it didn't work for me. While for someone who's a white American who had people who were, their ancestors were eating red meat all the time, for them it works very well. So I would really just say find what works well for you, and there's good clean metrics you can use to see what is working well for you. It doesn't need to be as expensive as like blood tests, but even just food journals, seeing what you respond well to is super easy.
Correct. So guys, you keep your food journal. It's a very good idea. Rather keeping a journal for your life or other things, we all talk about it, we all know it, but keeping a food journal is a fantastic idea, Rishane. And you have to be aware of how your body is behaving after a particular food, salty food or high sugar food, or meats, as he just mentioned, or vegetarian is your thing. So choose accordingly. You can have good nutrition with every kind of food. Taking good rest is very important, which is often neglected in metropolitan cities because people want to do fitness, but they want to do their work also. So they're sleeping 3 hours, 4 hours, sleeping in odd hours, and that adds to the problem, isn't it?
Oh yeah, absolutely. The lack of sleep is an epidemic. We have to fix that. Lack of good sleep, I should say.
That brings me to another common problem which we see, and which is how to maintain good hydration for people who are office goers as well and who want to keep good fitness and health as well.
Yeah, I think people need to buy more water bottles. Like I'm not even joking. I have 2 water bottles in my space right now because if you keep one at work and keep one at home, you're already there's going to be one day where if you bring your water bottle from home to work, you're going to forget one day. And then that day, you're just going to mess up your hydration that day. Then your workout is going to suck. Then you're going to not sleep as well because you didn't work out the same. Then the next morning, you're going to feel weird. And then you start this cycle that could all just be stopped by you having access to water, which, we're hopefully, if you're listening to this, you're very fortunate to have access to water. There's a lot of people that don't even have access to water. So having bottles around, setting reminders. A lot of the times we just forget to drink water, and then 8 p.m. comes around, you're like, oh shoot, I forgot to drink water. A lot of you will have to force yourself to drink water a little bit, whether it's setting alarms, whether it's keeping bottles around, but it's just like sleep, I think it's one of the most important things you can do is staying hydrated. On top of that, if you sweat a lot of people are runners. Running outside in India, you're going to be sweating a lot. Getting electrolytes, getting the right salts and minerals back into the body is very important. If you're just drinking water, but you're sweating out all your salts, you'll never really get hydrated. And then having a good electrolyte supplement to go with that can also be very helpful, or even a natural electrolyte.
What is your mantra of keeping good hydration?
I say I'm a fan of the gallon of water a day. Some people say it's overkill. I think it's a very easy thing to do. I just have like a half-gallon jug. I'll drink at least one of those, and then 2 of my other bottles, which are like 48 ounces or something. And I think that's very easy. I sweat a lot. I sauna a lot, and I'm training on my feet a lot. So I do need a lot of water. But I would say start with a reasonable water amount that you can do and hit that every day. If that's a half-gallon, that's great. Start with a half-gallon and then just do that every day. Set the alarms, make sure you get it done, and then kind of up your numbers from there if you need to. You don't even need a gallon of water. I don't think that's necessary, but you need a pretty a consistent amount for sure.
So guys, I mean, I think drinking at least half a gallon of water that's what he thinks is important for everybody who is not even exercising. But if you are exercising and sweating more, if you are in a country where you sweat more, the temperatures are higher, then you need more water. But definitely hydration is the key to not only keep your body healthy, but also to prevent injuries during your workout.
Oh yeah.
There's one more common thing which people struggle with, and me as a surgeon also I have very few treatment modalities to offer them, and it's so common. I'm talking about shin splints in runners. So do you think it's also related to going to the gym and exercising your muscle, or what do you think about shin splints, and how do you guide your trainees for that?
Yeah, so like we said, the shoes are very important. And then strengthening the tibialis anterior. So knees over toes guy, Ben Patrick, a lot of people know him. He talked about the tibialis training, and I think now it's become a little bit more mainstream, but there's those muscles on the front of your lower leg, so on your shin, that help you kind of absorb that impact. So if you're not strengthening that muscle, once again, now we kind of move up the chain, and up the chain from the shin is your tibia attaches to your patella via the patellar tendon. So that is where a lot of runners have their knee pain. That runner's knee is generally patellar tendonitis.
Yes.
So strengthening that muscle, that's going to be kind of like your first line of defense, arguably your second line of defense behind your foot muscles, which can also be strengthened. I've talked about a few different ways to strengthen your feet. Even just doing single leg exercises are going to strengthen your feet a lot. So strengthening those muscles there are going to be important. And then also just the overuse, having good, clean running protocols where you're not running your body down, no pun intended, are going to be very helpful.
I fully agree. Me being a long distance runner myself, I have seen people getting addicted to running and then ending up kind of beating the muscles down and then ending up with injuries. So it's important to hit the road or kind of run different kind of mix of your running styles. But it's very, very important for you to train in the gym and strengthen your muscles so that you don't injure them. Specifically for shin splints, training your tibialis anterior is very, very important. So yeah, fantastic. Thank you, Rishane, for that.
Of course. Yeah. If someone was bench pressing every day and they had shoulder pain, what would you tell them? Probably like, hey, you should probably cut that down a little bit or strengthen some of the surrounding muscles. Running's no different.
True.
Yeah.
Common sense. Yeah. Agree. So Rishane, how important it is for you and your trainees to kind of do a warm-up routine and a cool-down routine before the main workout happens?
I think it's so important. I think it's so important. And I think there was actually a time where people said, very recently, like last year or something, on TikTok, it was getting very popular for people to say, like, you don't need to do any warm-up routine. You just need to do the exercises and warm up with those. And I would argue, yeah, if you have really good mobility, like that's kind of what I do to a certain degree. I'm a little older now, so I don't know. When I
You're
was
just
younger, I don't
24.
know. I take like a little 2-minute warm-up routine for me.
Yeah.
The biggest thing is a good warm-up is about actually getting warm. If you are not sweating, I don't think you should touch a heavy weight. I think literally if you get on the elliptical, just break a sweat and then go through a 5-minute mobility routine. Some people are like, that's a waste of time. I say it's 10 minutes, and I think you're going to be a lot less likely to get hurt. Most of the injuries that I've had, most of the injuries that my athletes have had, it has usually been you're late to practice. You kind of
So
rush through
true.
a warm up and then you get hurt.
So
And that's how I see it. So I'm like, the gym is really no different. The gym, you should be taking the time to get warm. Some people make the argument, well, what if you're in the wild and a lion is going to chase you? You don't have the time to warm up. I'm like, okay, then let the lion eat me. Okay, that's fine. I'll lose. I'll lose on the off chance that happens. But a good warm up, I think, is just that, like 10 minutes, 5 minutes on the elliptical to get warm, maybe 5 minutes of a mobility routine, especially if you know you're tight around, let's say, the ankles or the shoulder or something, getting that warmed up, and then do your warm up sets. I'm just asking for an extra 10 minutes. Cool down, I'll be completely honest, I don't pay too much attention to the cool down. I think if you warm up correctly and you take your joints through a good full range of motion, I don't think you need to be doing a lot of static stretching at the end of your workout. Maybe if you have something like really tight hamstrings, really tight hip flexors that you deal with on a chronic basis that are impeding your athletic ability, yeah, maybe do a static stretch there. But I don't think everyone needs like a long drawn out 10-20 minute cool down, especially because people are busy. And if you'll meet me halfway and do the warm up, I'll meet you halfway, let you skip the cool down. I think that's a fair trade.
I couldn't agree more, because a lot of people would end up injuring themselves during a game or a routine when they have not warmed up. And in metro cities, I mean, I have done it to myself. I used to play lawn tennis back in 15-16, and I was back from the hospital and I was missing my training day on that particular day, and I straight away went to the court. I changed and I told my coach, okay, I want to do some hitting. I don't want to miss my routine. And I ended up injuring my gastroc muscle. So,
I had a trainer friend, so my age, like 24, 26, he tore his Achilles tendon playing pickleball. He didn't warm up.
No.
Yeah. So it's very common. And it's a fairly springy tendon too. So it's like, you need to get everything warm.
Yes, fully agree. So guys, very, very important to warm up before any kind of a workout. Wake up your muscles. It's like, you wake up in the morning and somebody tells you to write an exam straight away. You're not going to do well in that exam. You need to wake up your muscles. You need to kind of get them moving and then give them some work to do. So Rishane, have you ever trained a person who has had injury around the hip, let's say acetabular fracture, which was operated, or a hip fracture, which was operated, and then they come to you with stiff hip? My question is, I mean, because these guys after the surgery or after the injury have a lot of fibrosis and a lot of stiffness around the hip area. And how do we get them moving? That's the question. I mean, of course, if you have had a person with the hip or knee replacement surgery, that would be interesting to know. Yeah, please.
Yeah. So the first thing we did is, and I was lucky because this guy played football in college too, so American football in college. So he understood a lot of these movement patterns, like the squat, the deadlift. These were not new things that we needed to teach. I found that getting back after not right after surgery, obviously, but getting back into the gym after PT, after you're cleared to work out, a lot of the times people hyperfixate on isolation exercises. So just getting, like, let's say abduction down, IR, ER, whatever, flexion extension, all these specific isolated movements down. But that can kind of be painful, one, because you're isolating a movement, and then B, it can be a little bit frustrating or discouraging because it's like these are kind of basic, easy movements that feel very difficult for someone who was able to do these movement patterns. So the first thing I say is, the structure for them should be fairly similar to the structure for someone who, let's say, never dealt with any of that, where you kind of start with a good clean warm up, then you get into your compound exercises. With him, we had to regress, right? So we would do squats onto the box. We would go with a fairly wide stance. The closer stance was hurting him, and then kind of building up the range of motion there, as opposed to, let's say, a younger athlete who would just start squatting barbell as deep as they can, whatever. And then after those compounds, after the hip is warmed up, after they're feeling good, after they break a good sweat, after they've kind of subconsciously freed up their body a little bit, because a lot of these limitations, yeah, they could be structural, right? But sometimes they can be mental as well,
That's so true.
where yeah, they're just scared to have the joint move. You kind of bypass that fear mechanic in the brain after you do some of these compound movements, and then you can kind of start to build up on these isolation movements in these deeper ranges of motion. And it does take time, especially with the hip. It takes a lot of time. The knee, it really just bends and extends. The hip does so many of these other functional movements. Being able to develop those, and then the most important thing I think is also stability. So a lot of the times with the single leg work after the hip replacement, he would not feel as confident with that compared to the double leg movements. So once again, regressing those, not being scared to use the hands for support at first, and then kind of letting those go and trusting the hip to stabilize within the ball and socket without fear was the next step. And now he's moving very well. He's almost squatting all the way down comfortably.
Fantastic.
We're starting to hinge a little bit more regularly, not any barbell deadlifts from the floor yet, but it's moving a lot better.
Yeah, I mean, having treated a lot of hip arthritis patients or AVN patients with hip replacement, I'm very well aware that these people have, deep-seated fear that their hip may dislocate, it may pop out, and am I ready for going to shallow squats and maybe deep squats? So we have to really talk to them and get their mental barriers, which should deal with them first, and then, of course, according to the surgeon's prescription, I mean, we can take them down to the deep squats also. So may I ask, I mean, if this particular person whom you were treating, was the scar on the side or in the front?
It was on the side.
It was on the side. So then most likely it was a posterior approach. And why I'm asking you this, because there's a common myth going that people who have undergone a hip replacement surgery, they cannot squat. And over here in India, I mean, I do not stop even a single patient of mine who has undergone a primary hip replacement from going into squatting position or sitting cross-legged in, like we do in a temple in Indian culture. So I get this question very often during my live shows. There are very few surgeons. Most of the surgeons don't allow this. Why do you allow this? I said, you have to ask other surgeons why they're not allowing it. Because if your hip muscles are flexible and if you gain good strength during a rehab, then of course you should be able to do that if the component positioning is good and the muscles were kind of respected during the surgery.
Exactly. And yeah, maybe you might never want to barbell squat super deep with a lot of weight, but squatting is a basic human movement. Like anytime you get up from a chair, you're doing a squat. So if your surgeon is telling you you'll never get up from a chair again without help, that's scary. And you should probably find a different surgeon. And I really think that, because even with our squats, when we were developing our squat, we were doing it on a box and we were doing reverse banded. So he was holding onto bands, so he was weighing less than he would. So
interesting. That's very
nice.
nice.
You have to find the regression that works, but to just flat out push away a human movement, that would be, I don't think that makes a lot of sense.
So guys, there are surgical techniques, there are implant position related matters which we take care as a surgeon. But of course, when you go into your rehab and when you go into your going back to your normal life, then doing some tricks like Rishane just said, how to kind of reduce your body weight or the force you are kind of putting onto the hip joint or hip muscles, and you can gradually build it up and allow your body to kind of be ready for it. Yeah, that's such an interesting thing to hear. Thank you for that.
Of course.
Yes.
Yeah, that's super important.
Yeah.
Super important.
So, Rishane, there are a lot of people over here whom we see who are sick and tired of going to a gym and pumping iron or doing that routine, like doing yoga. And so they want to try something new. So there are a lot of people wanting to venture into calisthenics. Do you have a piece of advice for them who are kind of about to start with their calisthenics training? I mean, what would you like to tell them?
Yeah, my first I would say don't ever fully neglect the weights. I think the weights are very important. And the calisthenics lifters, they do work like lift weights. I know some calisthenics lifters that or calisthenics athletes that squat, barbell squat, and they're very good at that. But yeah, going into calisthenics, just making sure that you understand that a lot of these movements, people think they look easy because it's body weight, right? People think like, oh, a tuck planche, whatever, let's do it. It's very difficult.
Yeah.
Just like, and it's the same logic with running, right? That's why people think like, oh, it's just running. I'll just run every day and I'll be fine. And then they get patellar tendonitis. Same thing happens with calisthenics. If you just start trying to do front levers, trying to do tuck planches, even like a muscle up, these are not super easy movements. They're
I would
relatively
agree.
stressful on the joints. So there's a lot of these calisthenic pages that post very clean progressions and regressions. Like if you're a beginner, here's the first stage and there's 12 more stages before you finally hit this end result. And you need to kind of leave your ego at the door when you're going into those, because you could be the best weightlifter ever, but
That's correct.
you might just not be the best calisthenics person right off the bat. So you could be benching 300 pounds, but you might need to start at the level 3 progression before you work your way up. Just like if you a lot of these bodybuilders, if you get into jujitsu or something, like you'll be surprised very quickly that some skinny 150-pound guy is going to choke you out, even though you're 220 pounds of muscle, because he's been doing it longer and because he's practiced. So take your time, understand that it's not just, oh, it's body weight, that's easy, and because I work out, I'll be really good at it. It's very complicated. It's very interesting joint positions, a lot of stress on joints in ways that you've never loaded in the gym and may not be able to replicate in the gym. So just be patient with that. And for people who are frustrated with the gym, just all I do is work out 5 times a week, lift weights. There's plenty of other sports that are fun, classes that are great, other movement patterns, types of skills that you want to develop. There's a lot of other really cool ways to move your body that aren't necessarily with a barbell or even calisthenics.
Yeah. So thanks for that. Basically, if you are wanting to go into calisthenics, respect the routines, respect the easy progression, and have a good coach who can really guide you through, be it any kind of a mobility, flexibility, strength training, or whatever it is, be it calisthenics. Find a good guy who knows his job, and then just follow him, rather than doing it yourself and then thinking, okay, maybe I can do it because I've been gymming for a while, for years together, and I know my body. Sometimes your accessory muscles, your soft tissues around the joints are not just ready to take those kinds of extreme movements. Wow, Rishane, I'm learning so much. You're a fantastic guy. I'm seeing things from a very different lens. Do you know that? I mean, we being surgeons, we see everything from a lens of a disease. The moment a person comes to me, I don't think that. I always think, oh, he's a patient. Okay, what disease does he have? And generally, I'm looking, oh, find out disease. And there are so many things. I mean, there is a new. Now I've started to think like that. There are people who are fit. There are people who are healthy. There are people who are unhealthy, and there are people who are unwell or sick.
Yeah.
So we treat that sick segment, disease segment, and that's what kind of pulled me towards you, because you treat people who are unhealthy or people who are healthy but not fit, rather.
Yep.
I mean, you are dealing with a very different kind of a population with a very different technique. Your job is more of preventive, and my job is more of therapeutic.
Yeah.
So I think we can have an overlap where we can understand each other's approach and can help people, navigating through their problems, isn't it?
Exactly. Yeah. And I love that you also you're working out, you're running, you're understanding the demands. A lot of the times, so my sport is jujitsu. Like I've wrestled and done jujitsu forever. One of the biggest things with that we say, and injuries are so common in jujitsu, you're simulating death matches all the time, pretty much. If there's an injury, you need to find a surgeon that understands the demands of your sport. Because if you have a surgeon that's not going to understand how you need to be moving after your surgery to get back to jujitsu, they might not be the best fit compared to someone else who can get you back to sport. So, although I think the preventative side, you're also, I mean, you're doing a great job with that too, because you're talking about if you're running and I'm sure you've probably dealt with a couple aches and pains from running and things like that, and you understand the programming and the progression. If
Yes.
I need surgery and I need to get back to running, I'm going to feel a lot more comfortable going to you rather than someone who doesn't run, but they're just doing surgery. So I really do. I'm very excited that the new wave of medical care is turning into more people that are understanding the demands of the sport, trying to make sure that we're able to prevent some of these things, looking at all our options and making sure that we're going to be able to get you back into sport correctly, rather than just this needs surgery, this needs surgery, like over and over and over again, just blindly, because I don't think that's necessarily helping anyone, and especially when it's coming from people that don't even understand what you're trying to get back into. So I'm very happy to hear that you're, strength training, running, telling people they can get back to squatting. All these things are super important.
I agree with you. Yeah, thank you so much for your kind words. And Rishane, it was so good talking to you. I don't think I'm over with I have so much happening in my head, so many questions floating in my head. So, yeah, so you're doing a great job, Rishane. And at 24, you're just killing it, man. I'm so glad that I could get in touch with you and we could do this podcast. We've been trying to do it, and I'm glad you responded.
Of course. Thank you so much, Dr. Pankaj. Yeah, this was a good time. We have to do it again.